It's an important question to understand how someone gets to the hospital, I think, because the answer, unfortunately, is that at least in the next couple of weeks, we would anticipate that number going up. If you think about it, what we learned last year was that there's a certain delay in people being exposed to them becoming symptomatic, to them often getting a test, realizing they're sick enough to need further care, and then getting admitted. And traditionally, at least with previous variants, that timeline would be as long as sort of 10 to 14 days. So we would often sort of see quite a lag time, if you will, between mitigation efforts that we would put into place and their impact on hospitalizations. So you're right. If you look at the hospitalization trend in North Carolina, a couple of days ago, we crossed 1,000 people again for the first time in quite a few months in terms of hospitalized bed numbers. And it is baked into the system that number is going to go up for at least a couple of weeks. I think that people have to be aware that that's going to happen because all of those people who've been exposed yesterday, for example, are not likely to sadly get sick for quite a few days, not likely to get sick enough to need the hospital for a further time. So in fact, if you look at those numbers, our peak now towards the end of July often reflects what was going on in the middle of July, and that increase that we were seeing then reflects sort of July the 4th kind of timeline. David may comment, I think, as we go along, but one of the things we're seeing with the Delta variant is that timeline is condensed a little bit. You're in fact more infectious more quickly with this. So we are potentially seeing a hospitalization impact a little quicker than what we were doing. But people need to realize that exposures that have already happened are baked into the system for those people in ways that it's hard for us to avoid. The only real way we can avoid that at the moment actually is for people to be aware that if they test positive, requires people to get testing still, but if they test positive, we do now have interventions in the form of antibody infusions, so synthetic monoclonal antibody infusions that can avert the sort of severe end of COVID hospitalizations. So for the one thing we do have up our sleeve, if you test positive because you've become symptomatic, and it's important for people to get a test at this stage, let your clinician know. It is a wide group of people for whom there's benefit in actually getting those infusions. And we can go into those details if people need.